So thank you very much, Matt, and we can go on to the next slide, but really appreciate everybody being here again today. We're glad to have our Cabinet Secretary for the Public Education Department here again. He was here recently, Kurt Steinhaus, with an exciting update about a pilot of a great new program going on in Alamogordo and soon across the whole state. Today, unfortunately, after a lower day yesterday, we're reporting 1,166 cases, 419 people in the hospital with COVID, which is high, and unfortunately 12 new deaths. One death is too many, 12 is 12 too many, and for every one person, there's 10 or 20 family members or friends who grieve that loss. About 6.7% of people, which is about 1 in 16, I think, if I'm doing my math in my head correctly, are hospitalized that get COVID. And unfortunately, a small percent, 1.8% of people who get COVID die, but it's actually among those hospitalized, it's 19%. If we go to the next slide, we're going to go to Laura, who's going to give us an exciting update on lots and lots of news on what's going on with vaccinations in the state. And then she'll hand it off to Kurt, and then I'll be back after that. Laura.
Thanks so much. I'm really excited to report that our vaccination rates keep on going up. So 72.6% of New Mexicans are now fully vaccinated, and 54.4% of New Mexicans 12 to 17-year-olds are fully vaccinated. 82.5% of New Mexicans 18 and over are partially vaccinated, and 62.6% of New Mexicans 12 to 17 are also partially vaccinated. And then this is exciting, 171,806 New Mexicans over the age of 18 have received their booster dose. And then next week, we will have vaccine statistics for 5 to 11-year-olds on the dashboard. So thank you again, New Mexico, for getting vaccinated. We're super excited because every vaccine more is another death we can potentially prevent. Next slide. So we've seen an uptick in vaccine administration. That's from boosters, and also we've seen a little uptick in people getting their first doses, as well as their becoming fully vaccinated. So this is exciting, and once again, we thank our whole amazing vaccine team and all the providers out there who are giving vaccines, and all of you guys going out there to get vaccinated. Next slide. This is a very cool slide. I really like it because it says that it's a slide that looks at social vulnerability index. So that's an index that looks at who in the, which areas in the state are most socially vulnerable. And here it shows that, no matter you're in a high social vulnerability area or low vulnerability area, you're just as likely to get vaccinated. So once again, that's the work of everybody. And we're so glad that, it doesn't matter where you are, you can still get a vaccine. Next slide. Well, here's a little update on booster dose administration. You can see that the 171,806 doses of booster doses, we initially started with the group that were immunocompromised people being approved for the doses. Then when Pfizer doses were approved for for 65 and over, and people 18 to 64 in higher risk situations or high risk illnesses, we got more people vaccinated with boosters. And then here we see after the 3 vaccines were approved for boosters, we see another uptick. So, this is great because we are seeing higher cases. So the more we get boosted, the more we get vaccinated with our primaries, the more we'll start to be able to end this pandemic. So thank you. Next slide. Okay, so this is the moment I think many of us have been waiting for. 5 to 11-year-old vaccines have been approved. You can see that there are very many steps that we had to go through for safety purposes. Yeah, here we are. So I know a lot of us who have 5 to 11-year-olds are super excited, or people who have friends that have 5 to 11-year-olds or grandkids. This is a really great moment for us. So next slide. And I don't have a 5 to 11-year-old, but I do have friends who have them. And I know a lot of my doctor friends are super excited about this. And I know I was super excited when my kids got vaccinated. So did you want to add something, David?
Yeah, Laura, I don't normally interrupt you, but I was talking to my son in Michigan this morning, and he has two sons and I have two grandsons of his that are between 5 and 11, and they both have their appointments set up for early next week to be vaccinated. So all we have left in this grace brood of grandkids is the two really young ones, 2 and 4. But the 4-year-old's parents are counting the days until she turns 5 and can get vaccinated as well. So sorry for bursting in, but I'm one of those people who's really excited as well.
I am super glad you burst in. I think this is really exciting for a lot of people who have 5 to 11-year-olds. So it's now available, the 5 to 11-year-olds for New Mexicans. The CDC actually estimates that for every 10 children we vaccinate, we actually can prevent a single case of COVID-19 in another child. The Pfizer dose for the children, it's a smaller dose, so it's a third of the adult dose. And it's similar to the adult doses that you get 2 doses of the Pfizer vaccine with 3 weeks in between each dose in order to become fully vaccinated. And vaccines for the 5 to 11-year-olds are being delivered to New Mexico. So there's some slots available right now, but we're waiting for providers to get all their vaccine. By the 10th, we should have all the doses. So please be patient as we go through this process as doses begin to arrive into the state. You'll be able to see more and more scheduled appointments available as the week goes by. Next slide. What's really exciting is that we really have a lot of data on the vaccine showing how effective it is. Looking at adolescents, 12 to 18-year-olds, who, we still need more adolescents vaccinated, but we've seen that vaccination reduces your risk for COVID-19 hospitalization by 93%. And we also saw that in the children vaccines for the 5 to 11, that it was 90% effective in preventing COVID. This is really important because even though children don't usually get as sick, there are still children who can get sick from COVID and get hospitalized, and even 5 children have died in New Mexico, so we really want to prevent that. You can see in this that none of the kids that got vaccinated with COVID who are adolescents actually ended up in the ICU. So really good data to show that this is super safe for our kids. Next slide. One other cool thing that they found in the study that they did to make sure the vaccine was safe was that side effects in 5 to 11-year-olds are milder than in older children. So these are the common side effects that kids get, and it just shows that the vaccine is working. But that's pretty cool that it's less, it's more mild than older children, and it's probably because of the smaller dose that the kids are getting. Next slide. You can register your child today, or if you haven't already registered them, at vaccinenewmexico.org/kids. You, as a parent or guardian, you can link your child's profile to your own profile and manage your child's profile on their behalf, including updating their profile information, scheduling their appointments, and completing their parental consent forms. Scheduling opened this morning, and already thousands of parents have gotten appointments for their kids. So that's super exciting. Next slide. There's a little instruction page on vaccinenewmexico.org/kids where it shows you how to link your profile to your kid's profile. And, of course, full vaccination, as 5 to 11-year-olds are the first priority, as well as other people who aren't vaccinated, because it's still the best way for us to prevent hospitalizations and deaths. You can make your appointment today if you haven't gotten vaccinated yet at vaccinenewmexico.org, or you can schedule an appointment with your primary care provider or a pharmacy. Remember that you can get a flu shot or any other shot at the same time. And talk to your provider if you do have questions about the vaccine or eligibility for a booster dose. We're just really encouraging people to get out there and get vaccinated right now. Next slide. Our call center is still here for New Mexicans that don't have an access to the website. The purpose of the call center, as usual, is really to advance equity by supporting people who don't have internet or the capacity to schedule online. So if you do option 3 or 9, it helps people get to a Spanish speaker, and we're open from 8 a.m. to 8 p.m. So once again, please just use it if you don't have access to a website. If you can do it on the web, that really helps our team. So thanks again for all you guys are doing, and yeah, get out there and hopefully get vaccinated. Thanks. And now I'm going to turn it over to, our awesome Secretary of the Education Department, Kurt Steinhaus.
Laura, thank you so much. And thanks for that great report. I'm happy to share that just 2 days ago, I got my Moderna booster shot, and I found the Department of Health registration site to be really easy to use. My pleasurable job this afternoon is to talk about a new program that is a huge partnership with schools across New Mexico, the Department of Health and the Public Education Department. We call it Test to Stay, and it's a part of us moving forward with the goal we've had from the very first day of school, and that's to provide in-person learning as much as we possibly can. And I'm happy to report that's working really well. This Test to Stay program is brand new, and it's going to take some time. Our school districts will be taking training. They'll be getting certified. In some cases, they might even be hiring staff. So it's going to take 3, 4, or 5 weeks for this to get up and running, but we thought it would be important for you all to know about it. On the next slide, it gives you a quick summary of what this thing is all about. So we sometimes call it in short terms just T2S, and it allows unvaccinated students and staff who've been exposed to COVID-19 somewhere in the school to actually stay in school and not have to quarantine. That's the basic part of it. So it does, when it's working, it replaces the 10-day quarantine. It is a part of a 1, 3, and 5-day testing program that we'll be following. And if the tests are negative and the individual's asymptomatic, that student or that staff member can stay in school. And the other thing that a lot of our staff and parents are very excited about, not only can they stay in school, but they can also participate in all those sporting activities, as well as speech and debate and band and music and theater, all those things that make school so exciting for kids. On the next slide, it gives us a quick summary of the goals. So as I've already stated, the goal is to keep New Mexico students and staff safe. And that's what we're working on, and we're getting better on it, better every week. We want to minimize quarantine times, and we want to keep our kids engaged in in-person learning. That's what this is all about. The other thing that we know is that every school, every community is different and unique in some ways. And so the flexibility that we're able to provide in this program helps us adjust for local community needs. And I'm also happy to share that on the next slide, we can give you an update about the Community of Alamogordo. I was a teacher in Alamogordo for 11 years, and know there's a lot of good folks down there. They volunteered last week to give this a try. And so they are finding out information about how it's working and how we might do a better job of providing training and communication. So 3 cheers to the Alamogordo folks. And they are implementing this testing program on days 1, 3, and 5 following an exposure. And that's a little bit about how it works. And on the last slide about this program, the next slide gives you just a little bit of information about the benefits of the program. It does not only allow us to increase in-person learning, but it allows kids to continue to ride those school buses. After school and before school programs, students and staff can still participate in that, aftercare programs, and all those wonderful extracurricular activities. And we're looking forward to working with our school districts and moving forward with this program. Also want to share a big thank you. Sometimes when you've got a new program like this, it comes down to one really hardworking person that is the key to making this happen. And Dr. Tom Massaro has been the partner at the Department of Health that's been key in getting this implemented. So big thank you. We look forward to working with all of our students, staff, and parents in getting this implemented in the next 3 to 5 weeks. And I think it's back to Secretary Grace.
Yeah, thank you very much, Kurt. You know, Tom Massaro is the Chief Medical Officer of the Department of Health. We're going to be working together to get everyone trained up. In the end, I think we'll have a lot more folks able to actually stay, a lot more kids able to stay in school and ride through the quarantine period safely with this advanced testing program. I think there's a lot of excitement out there, but we want to take the time to get people trained so we can do it right. So I'm going to walk through both epidemiology update and hospitalization data, double duty today. And so let's move right ahead, Brianna. This is our usual number of cases. And you can see by the top is all cases and the bottom 5 lines are actually different regions. So there's 6 pieces of bad news. All 6 lines are headed upwards. The problem with that gray area, you know, we're not supposed to look in the gray area, but at the same time, the gray area can only go up. It can't go down. So we go back 7 days to add cases in as we get test results back later. So we're definitely on another uptick, which is not what we want to see when our hospitals are actually stressed to the maximum. Next slide, please. The whole state is pretty much red. We do have some low test positivity rates, though, in Harding and in Los Alamos counties. So that's good. Also, you know, any test positivity rate below 7.5 is where we want to see it. So I think there's maybe 6 or 7 or 8 counties in that area. But on the total new cases per 100,000 people, we want that below 10. And you can see that only one county, Los Alamos, is there now. Next slide. Also, our test positivity is rising. We think some of this may be due to people doing more home testing. In theory, well, not in theory, the public health order requires reporting of all home testing, but that's can be an arduous task for somebody who just does one test at home. Some of the newer tests are set up electronically to report your results, but so we may be losing some negative tests from the denominator, but nonetheless, we don't like to see the test positivity rate almost up to 10%, and that's something that we absolutely need to see come back down very soon. When we get over that green line, it means we're missing cases, that we're not really getting our arms completely around all the cases occurring here in New Mexico. So that's why we'd like to continue to encourage everyone to get tested. If you have symptoms, you're exposed to someone with COVID, and that applies even if you're already vaccinated. Next slide, please. In schools, Kurt went over the program that we're doing, had almost 1,000 cases in schools last week, but it's only about 1/6 of cases in schools that are actually pediatric cases, which is 17 and under. We cleaned up this graph thanks to our epidemiology folks. We took out all the adults, so these graphs look bigger, but 80 cases a week at our peak and 50 where we are now really is only about, this is the daily case rate. And so that is pretty manageable here in our state and better actually than other states are seeing. And as I mentioned last time, if you remember at the beginning of the year, we were seeing 3 staff cases for every single student case. Now it's flipped. We're seeing 3 student cases for every staff case. And we think that's mainly due to the effectiveness of vaccines and the fact that most of teachers and staff are vaccinated, the majority are, whereas of course, a lower percent of students are vaccinated right now. And certainly in elementary schools, none of the students, unless they get a vaccine today. Next slide, please. These are hospitalizations in kids. We took out the adults. You see a lot of very choppy lines there, and which looks like a lot of instability. But if you go over to the left side of the graph, and maybe Brianna, you can point to that y-axis, you can see that over the past, basically, let me look at a time period since July when Delta came through, the most number of hospitalization, the highest hospitalization rate was 3 per 100,000, which is very, very, very low. So we're still doing very well on the kids side of things. No children hospitalized, and we still think that relates to our high state vaccination rate. And there have been 5 pediatric deaths. Sadly, no new ones in recent weeks. There was one case recently where there were no underlying conditions on the death certificate, but we've reviewed those medical records, and the child did have some serious underlying condition that probably, in all likelihood, made them at higher risk for death from coronavirus infection. Next slide, please. Hospitalizations and deaths. We continue to move up. Modeling is predicting an increase in hospitalizations. We're moving more and more into the red. We've already declared crisis standards of care, and so hospitals continue to struggle. We have been successful in some ways of helping hospitals out that I'll get to. And just as a reminder, on the left, those are the different things that we're monitoring. And the one that's yellow, sustainment means, what that means that it's yellow is we're not sending healthcare workers with COVID into the hospital to take care of COVID patients. So thank goodness we're not doing that. I know a lot of our hospital folks feel like, it's tough to imagine it getting any worse, but we're continuing a tough situation. I would appreciate that if you don't feel like wearing a mask or getting vaccinated for yourself, it's still a great thing to do to support our hospitals and our healthcare workforce. Our healthcare workforce isn't just about battling the pandemic. It's about us growing old in a state where we have enough doctors and nurses and physicians assistants and nurse practitioners and respiratory therapists and all the kinds of healthcare providers we need. And believe it or not, everything we do to protect ourselves from getting COVID and ending up in the hospital actually contributes to keeping that workforce around and keeping it as strong as we can. You can see we're grading ourselves every week on a 0 to 40 scale, and we're at 36.5. So the highest we've ever been in the state in terms of how our hospitals are doing. We have had some success, and let's go to the next slide here, please. You can see still 17 beds in the ICU, 82. Those numbers are, again, headed back down. Most of the time we have an open bed in the morning in an ICU. It's filled very quickly. So this is very, very tight situation. And you can look on the map and think about where you live in the state and where the nearest ICU bed actually is to you in that map on the left. And some New Mexicans would have to drive hundreds of miles. We're also transferring people from one place to almost the farthest away. Last week I talked about transfers from Farmington down to Las Cruces. You can see they're pretty much filled in their ICU beds. So we continue to try to treat the state like a single large ICU, but that does involve extensive use of transportation resources. Next slide. We've been working aggressively with the federal government to try to request additional resources. We also have developed a contract with a staffing firm called Jogan. And you can see here that we've ordered up, and folks are on their way or already here for 196 additional healthcare workers in New Mexico. I think maybe last week we showed you what the different types of healthcare workers were. This week we're showing you where they're all going to go. We do have some empty floors at Loveless, so we're trying to get extra staffing there in Loveless Hospital in Albuquerque so we can reopen those floors and have more room for hospitalized patients. 41 people to our most challenged hospital right now is Farmington. I got word this morning that they did declare crisis standards of care, and we have a federal emergency medical team coming into Farmington this week as well. We have a verbal approval for that, and communications are occurring. We don't have it in writing, but we're confident. And so we're going to have 36 people, mainly helping in emergency rooms and general medical floors in San Juan Regional Medical Center to help see if we can offload this incredible burden. The good news is that all of this extra staff can be paid for by federal funds. DOH is coordinating all these asks for-profit hospitals. The not-for-profit hospitals can submit their own requests to FEMA, but we are finally starting to see some relief from outside the state coming in. I think as other states have lesser caseloads and New Mexico stays high, we are able to take advantage of diverting some of the staff here. And so that's a positive development actually for our hospitals. And I was told today that the folks at San Juan Regional Medical Center were cheering actually yesterday when they heard about the federal team coming in to help as well. Next slide, please. Deaths, maybe some positive news here. It looks like we really do have a plateau. I don't have a really good explanation for that just yet for you all, but normally this would backfill even more, and some of these numbers have only gone up by 1. So it does look like we have a real plateau in deaths, which is, of course, very welcome. Although, as we mentioned, there were 12 today, and of course, we're over 5,000 now at 5,073 as of, I believe it was yesterday, not the first. Next slide, please. I wanted to mention to the folks who live here in New Mexico, I mean, we've had over 5,000 people who've died from COVID, and many of those folks are eligible, their families are eligible, sorry, for funeral assistance. And you can get monies from the federal government up to $5,000. If you already have funeral insurance, which is why it's not every single person is eligible, then you're not eligible. But so far in New Mexico, 1,682 people have registered. So to our media partners today, if you can help us get that word out, we're only scratching about 1/3 of the potential cases. We'd like everybody who's eligible to apply. Of those 1,682, just over 1,000 have already gotten money, and almost all of them were approved. The only rejections I already mentioned were due to if you already having insurance benefits. So we've got the application numbers here. Hopefully you've read ahead and jotted those down. You can call from 7 a.m. to 7 p.m. Mountain Daylight Time right now. And then after this weekend, you can go from 7 a.m. to 7 p.m. Mountain Standard Time, and they will help you and take your application. But we encourage people who are strapped for financial resources to take advantage of this federal benefit. New paragraph, new slide, please. Treatments, again, good news on the treatment front. Next slide. We've got some nice work being done. Lots of remdesivir being used in the hospital, antiviral medication to treat people. Almost everyone gets it. A little teeny bit of a fall off this past week in monoclonal antibodies, but we're doing a good job switching over to the BAM-EDI combo, which gives us more flexibility as Regeneron supplies are a little bit tight right now. Again, if you have symptoms of COVID and you're COVID positive by a lab test, you're over 64 or you're obese, or you have any of the many risk factors for more serious COVID, you should really seek out antibody treatment, monoclonal antibody treatment. It will reduce your risk of hospitalization by 75%. That's very, very significant. Next slide, please. And then we again have some real heroes around the state: Presbyterian, Gerald Champion, Gallup Indian Medical Center, San Juan, and Carlsbad, all doing a great job. You know, I know we might get a question today about fluvoxamine. It's an antidepressant. There was a study done in Brazil about the effectiveness of that treatment. I'm happy to take a question more specifically, but I think there's a lot of debate in the scientific community. It certainly is a large enough study, 9,000 people, but there's some criticism that the way the statistics were handled, they picked a very, very small isolated group to prove a reduction in hospitalizations and mortality, and the data may not show that in the large group. So we're a ways away here in New Mexico from serious consideration of recommending this drug as an alternative for New Mexicans to reduce hospitalizations and deaths. If we get better evidence or more information comes through, of course, we'll let you know immediately. Next slide. So last slide, and we'll open it up for questions. You know, clearly New Mexico is headed upwards. We need to be even more careful because the spread of Delta is much more robust. Delta seems very effective in finding pockets in families and in workplaces of unvaccinated people and spreading quite rapidly. Please get tested. Please get treatment if you're positive and meet the criteria that I talk about every week and talked about again this weekend. Indoors is still not a safe place. I still get emails from people saying there's no evidence that indoor masking helps. That's not true. We have on the medical advisory team website, I think we're over 24 articles showing the effectiveness of masking, also showing effectiveness of masking in children as well. It does reduce the spread. It doesn't eliminate the spread of coronavirus from one person to another. We've never said that it did, but it significantly reduces the spread of COVID, and we still recommend it. Wash your hands, wear those masks, keep your distance, get vaccinated. If you haven't already, get a booster. I think folks are not really realizing the benefit of a booster at this point in time, and we don't have enough data because boosters have only been out now for 3 or 4 weeks, but we'll start reporting data on vaccine breakthrough cases and those with primary series plus a booster. And I'm going to predict it's going to be dramatically lower, that it's going to be rare to see someone with primary series plus a booster getting COVID. I had my booster. Dr. Parahone had her booster. Dr. Steinhaus has had his booster. All of us for the same reason. It's because we're over 18 and we have an underlying condition. And so please, I think if you've gotten the impression from us that a booster is optional, I want to make sure I clear the air on that today. Every New Mexican who's eligible for the booster really ought to be actively seeking it. I also, you know, I hesitate to ever predict anything because I almost always, you know, there's no way to know the future, but I think we're going to see a relaxation on booster availability soon, and that I don't know when, but sometime in the next couple of months, we may be getting messages from Washington that really boosters are for everyone. So for now, if you meet the criteria, please, please get your booster shot. I was going to hold up my phone with my vaccine record that shows my booster, but I know you believe me. I will show you a picture of my 2 grandsons. Not sure if that's coming through or not, but they're the ones on the left and the right who are getting their booster shot early, or their vaccine next week. And now back to you, Matt, to kind of lead us through our media Q&A. Thank you.
Great. Thanks so much, Dr. Scrace. So as usual, everybody, we'll just do the raise a hand method. So if you're new to Zoom, there's a button that allows you to raise your hand, and I can see 5 members of our media team have done so already. So as usual, I'll just call on 3 folks at a time, and we'll go in that order. And when I call on you, please do just identify yourself by name and outlet. And then finally, just a reminder, no need to cluster questions. Please just ask one question. We'll cycle through the list as many times as we need to until everybody has a chance to ask all the questions that are on your mind. So with that, we'll start with Chris Mckee, followed by Julia Goldberg, followed by Jeffrey Plant. Chris, you are unmuted.
All right. Thank you very much. I appreciate it. This again is Chris Mckee here over at KRQE News 13. Along this line of boosters, there was some discussion here in our newsroom today that perhaps the state may feel disappointed so far in the uptick of boosters. So I just wanted to put it out there in general. Is the rollout of boosters and how many are getting out there, do you think sufficient, or are you encouraged by it, or would you like to see more? Do you think we can do better?
I'll start, but Laura, you can fill in some of the details. I think if the governor were here, she would love to answer that question. And she would say, I would prefer that everyone already had their booster shot. So that's probably what she would say. I think we've been reporting it in a way that might be a little misleading when we say 10 or 12% of New Mexicans have a booster. That's all adults. And, we've only had 2 or 3 or 4 weeks with Pfizer online, Moderna, and J&J just coming online now. So we're anticipating an uptick. We have 172,000 boosters so far. So we're a little faster, I think, in some ways than when we initially rolled out the vaccine. I think Laura and I were talking earlier today. A lot of people have really appreciated the reminders that the DOH has been texting them or emailing them about getting their booster shots. And so for those folks who've gotten a reminder or two but haven't yet come in, I think those of you who are in that category will see a lot more reminders coming up soon. So I'm happy with where we are so far, but it needs to turn up, and we need a lot more people. Remember, New Mexico was first in the United States in our vaccine rate for a really long period of time, which means we're first to be due for boosters. I'd love to see a duplication of our past performance in that. Laura, what would you like to add?
Yeah, the only thing I'd like to add is that, the group that is most at risk is the 65 and older group for the boosters. And so far, according to our information from our data system, about a quarter of 65 and over people have gotten their booster doses. So I think that's very exciting. And then now with the onset of Moderna, a lot of seniors had gotten Moderna, people over 65 had gotten Moderna. So we hope that we'll see another bump in that, because we do really want to protect those who are most at risk of having hospitalizations and deaths. So the older you are, the more chance you have for that. So yeah, we want to see more. And like David said, we just turned on Moderna and J&J just last week. So I think we're doing as best as we can, but you're right. Let's keep on going on the boosters.
I think I saw that we had 40,000 Moderna already, though. So that's very encouraging as well. So that's good. Chris, if your real question is, do you want us all to write a story about how more New Mexicans ought to get boosters? Then the answer is an unqualified yes to that one.
Thanks very much. Next, we'll turn to Julia Goldberg, followed by Jeffrey Plant, and then Gabrielle Burkhart. Julia, you are unmuted.
Thanks, Matt. Thanks, everyone. This is Julia Goldberg with the Santa Fe Reporter newspaper. Dr. Patajones-Grace, I was hoping maybe you could just verify or clarify regarding the 5 to 11-year-olds. It's my understanding that if someone has a child who's almost 12 or will turn 12 in between doses, that they should still stick with the smaller dose, and that those are smaller based on age and puberty and hormones, not like if you have a large kid, not a large kid, but like it's not based on weight as some other types of medicines are. But I wondered if you could just talk about that at all and clarify.
Okay, yeah, I'm happy to share with that. So that was guidance we got from the CDC. So basically, let's say you're 11 and in 2 weeks, you're going to turn 12, but you get the smaller dose, the childhood dose at 11. Then when you turn 12 and 3 weeks later, you get the vaccine, then you get the full dose. But you don't have to restart your vaccine. They have to make a cutoff somewhere. So yeah, so you'll get the 5 to 11 child dose, which is a third of the dose when you're 11, and then when you turn 12, you get the full dose.
Yeah, but you're right, Julia. There are many other factors at play other than just weight. And one of the things about pediatrics for me that I found difficult was that everything was in kilograms, and you had to multiply the kid's weight by, in kilograms by some dose per kilogram for almost everything. So back then I didn't like math as much as I do now. And so I went into internal medicine.
And Dr. Patajon, sorry, how many 5 to 11-year-olds does New Mexico have? I'm sorry, Matt, I know that sounds like a second question, but it's not.
It's 188,866, right?
We have that memorized. Yep, we do
Thank you.
have that many kids.
Sorry, I didn't mean to scoop you, Laura. I didn't know.
No,
had it
you
memorized.
go. You love that number.
Right,
So
I love that
think we should
number.
Go for it.
Thanks, everybody. Okay. And next we'll turn to Jeffrey Plant, followed by Gabrielle Burkhardt, and then Dan Mckee. Jeffrey, you are unmuted.
Thanks, Matt. Thanks for taking my question. This is Jeffrey Plant with the Silver City Daily Press. The question everybody in Grant County is asking right now is, why is COVID spreading so rapidly here, and why now? The only theory I've heard from physicians is that this surge might be coming from schools and school-age kids. Is there any evidence to support that theory? And by the way, I'm told by the superintendent here in Silver City that most student and staff infections are actually occurring at home and not at schools, because schools have robust social distancing and masking policies in place. But is there any evidence to support the idea that this high test positivity rate increase in infections is being caused by school-age kids and coming from schools?
Yeah, Jeff, I'll start. First, I want to thank you for the great question, and B, providing part of the answer. And Matt, we should explore whether we should require reporters to provide part of the answer to their questions. Jeff, it's a really great question. We have spent many hours over the past 2 weeks trying to figure out what the drivers are for the rise in cases right now here in New Mexico. I think that we're all very convinced that schools are not actually fueling the spread of this. We know that children can get COVID, they can spread COVID just like adults can. But as we do the contact tracing in schools, there's very little. In fact, the infection rate in schools based on the data the schools collect is very, very low, maybe like 4%. And historical data we have pre-Delta, the infection rate in a household was 16%. There have been papers on Delta that the infection rate is 50% in a household, as opposed to the 4% we're seeing in schools with Delta. So I think not. I mean, other things we're thinking about are waning immunity. That's the reason for boosters. And of course, if New Mexico was #1 in vaccinating people, then we would be, in the first to get so many people vaccinated. Then of course we'll be the first at 6 or 7 or 8 months to see a rise in the number of people with potentially declining immunity. Hence the stronger pitch this week for everyone getting booster shots. I think there's something I already mentioned about Delta itself, that it's just so infectious. And so I think a lot of what we're seeing is just the huge infectivity of Delta and its ability to find and spread amongst unvaccinated people. School kids are unvaccinated. Schools have cases, but they in general parallel the case rates in the community. They're not a lot higher, which would be another clue if schools are driving community infections as opposed to vice versa. So yeah, and one last thing that you sort of alluded to with your quote of the school superintendent is that when the modeling team originally looked at return to school, the modeling that Lanol did appeared to show that kids were actually safer in school than they were out in the community because of the rigorous adherence to masking and distancing and being careful. So I don't think there's anything out there that's implicating the schools as a source of spread. And actually, the wonderful program Kurt described to you that we're going to be working on intensively over the next 4 weeks kind of is based on the fact that schools are a safe place. And so kids who've had contact with cases in school can participate in the program. So I guess the really short answer to the question is no, we haven't seen that evidence that schools are feeling the current uphill now turn of events.
Great, thanks so much. Next, we'll turn to Gabrielle Burkhart, followed by Dan Mckee, followed by Michaela Heelan. Gabriella, you are unmuted.
Hello, thanks for taking my questions. Gabrielle Burkhart here with KRQE. I have a question about the 5 to 11 age group. We've seen some national polling where parents have said, you know, a third or for absolutely getting their kids vaccinated, another third are against. Some are still waiting and seeing. Does the state of New Mexico have a clear goal that it's hoping to reach when it comes to vaccinating that particular age group? Like, are we hoping to hit, you know, at least half of parents to agree to get their kids vaccinated? Are you willing to say a percentage?
Do you want me to go first?
Sure.
I mean, I'm hoping that we'll have this. We have 54% of 12 to 18-year-olds vaccinated, and we're hoping for the similar goal. We know that over time, we have, like you said, the first 30% that just like, I'm out there, I want to get my kids vaccinated. And then the other group, that's the 30% of wait and see. That's kind of been how all the kids' vaccines have rolled out. And so as people see like, hey, the kids that, you know, the first kids were vaccinated and they're okay. We're hoping that, you know, we can provide the materials and, you know, listen and provide the information that those parents need to feel comfortable for their kids. And we're hoping a lot of pediatricians and other trusted voices in the community can share with their communities about how to address that kind of that watch and see space. But we really do think that the kids, you know, they're our next big unvaccinated group. And so the more people vaccinated, the less the virus can get in and, you know, mutate and spread to people who are more vulnerable. So, yeah, so I'm thinking, I don't know, 54% would be a good goal. I don't know, David may have a higher goal.
Yeah, I think also there are different phases to this effort, to every effort. There's a phases to the primary series. There's a phased effort to the boosters. There's a phased effort to new kids getting vaccinated. And so right now, we're just bracing ourselves and setting up, you know, half a dozen max vaccination sites for kids and others across the state in the next couple of weeks to handle that part of the volume. Our pediatricians are very geared up and gung-ho to start vaccinating. Pediatricians and family physicians love giving vaccines. They take great pride in their high vaccine rates. So we're just bracing ourselves for folks like my grandkids. Do you want to see the picture again? Just kidding. You know, the mad rush to come in. And then phase 2, and we're doing a survey now on attitudes. I think the Con Alma Foundation is sponsoring to find out what are the messages that middle third group need to hear. What are their reservations? What are their hesitancies? You know, and then we'll gear our messaging. And I'm just guessing it's about safety and, you know, side effects and things, you know, like that. We haven't focused on those today because we want to get the word out that we're open for business, vaccinating that third of people who really want to get their kids vaccinated as soon as they can. So you'll see it'll change over time, Gabrielle, and we'll tailor our messages to progressively smaller subgroups of people. You know, adults, our survey showed that there, you know, 30% of adults in New Mexico said they would never get vaccinated no matter what happened. And we're now at 82% with at least one shot. So I think over time, those numbers are going to go up. I think as more and more people get vaccinated, it'll become and boosted. We're going to go back to a world where mainly only vaccinated people get COVID and get hospitalized or unfortunately die from COVID. And so I think it'll evolve over time. But now we're focused on the mad rush, and that all the people I know who ask me every time I see them, when are my kids going to be able to be vaccinated?
All
And
right,
the answer is now.
Thank you.
Thanks, everybody. Next, we'll turn to Dan Mckee, followed by Michaela Heelan, followed by Jaden Torres. And Jaden, I see 3 different Jaden Torres on here, so it's possible that somebody else from your network who's signed on. So please just introduce yourself when Are we calling you? Dan Mckee, you are unmuted.
Hi, this is Dan Mckee with the Albuquerque Journal. Can you address whether New Mexico has received its first shipment of the kid-sized doses? And if so, how many we have? Thank you.
Yeah, thank you, Dan, for asking that question. We have received our first doses. The doses are coming in 3 waves. We have a total about 90,000 doses that are coming into the state. So we got our first approximately 30,000 doses last week. And then we'll get our next group of vaccines will come, I think today or tomorrow, November 5th, I believe. And then November 10th, we'll get the last installment for the 90,000 doses. And there won't be any, I don't think there'll be any kind of delay in getting more doses if we ask for more, but that's how they're rolling it out. So that's why we're asking for patience in terms of waiting. You can get a scheduled appointment, but as providers get their doses, then they'll open up the scheduled appointment. So just keep on checking, seeing, every day we'll get more doses. So that's kind of how it's rolling out.
Thanks, Dan.
Thanks.
Great. All right, next we'll turn to Michaela Heelan, followed by Jaden Torres, followed by Tommy Lopez. Michaela, you are unmuted.
Thank you. Hi, this is Michaela Heelan with UNM and the New Mexico Newsport. This question is more so to clear the air for parents that I've talked to. One of their concerns is that because the dose for children is smaller, that it'll be less effective. Can you comment on that, please?
Yeah, sure. I'm happy to comment. So the reason why the dose is smaller is because the children are smaller, and they basically tested it on 3,000 kids, and it showed that there was a 90% effectiveness in preventing COVID-19. So the reason why it takes longer to test children is that they do have to get the dose just right for the kids. And so I'm hoping that reassurance on how they did the vaccine trials could reassure a parent that that smaller dose is what was needed to get that effectiveness, which was 90% to prevent COVID. So it's similar to the adult. It's a very good effectiveness rate. And so hopefully that would help parents who are on the fence about, is it effective? Is it not effective? Yeah.
Well, and I think too, Michaela, it's a good question. I think if you're a vaccine manufacturer, you want to maximize effectiveness and minimize any potential side effects. So it makes sense that they spent the time that they did coming up with that exact dose. Another example of that, though, is the booster for Moderna. The booster for Moderna is half the dose of the original first 2 shots, one of each of the first 2 shots. So I think we're learning as we go, but the effectiveness is impressive, and actually the very, very low side effect profile also very impressive for the child dose of Pfizer.
That's true. Yeah, and it's so good that you asked that question too, because like I think UNM was one of the sites for the research studies, I believe, right? And so they did have to kind of, because children are still growing and developing, they do have to adjust those doses. And so that, I think that could be something really reassuring to parents that they actually did, that extensive study. And they're also giving smaller needles out. That's a maybe reassuring thing for kids. The needle for the kids' doses is a little bit smaller.
Thanks all. Next, we'll turn to Jaden Torres, followed by Tommy Lopez, followed by Susan Montoya Bryan. Jaden, you are unmuted.
Hey everybody, this is actually Stella Sun with KOAT. I thought I was logged into mine, but
Hi,
I
Stella.
guess.
Stella, I think you're on mute now.
Whoops. Stella, are you with us? I see another person. Let me try this again. Let me try something else here. How about now?
Hi, can you guys hear me?
Yeah, we can now.
Hey, so great to see you guys. My question is for Secretary Steinhaus. I'm hoping you could clarify for me in terms of the testing for kiddos. What will that look like? Are these take-home kits for parents, or are parents expected to bring their kids to testing places every first, third, and fifth day? And then I think my audio cut out for a moment on my end. The program you said launches in 3 to 5 weeks.
I'm happy to answer that, Stella. The way that testing will work in our schools is that they don't have to go somewhere else. They don't have to make an appointment. We will have staff who have been through training and are certified, and they will conduct the tests there in the nurse's office or some other private place within the school. So that's how that part's going to work. What was the other part of your question?
Did you say it rolls out in 3 to 5 weeks? It cut out.
Oh, yeah. Yeah, timing. We will have some school districts who will ramp up very, very quickly just because they already have the staff and they can find the time to do the training. Other schools across New Mexico will take 3, 4, or 5 weeks. And based on what we learned from the pilot in Alamogordo, that school district was able to get the testing started within about 48 hours. So we're just going to wait and see. As you know, we have a lot of schools in New Mexico and over 425. And this includes public schools, charter schools, private schools.
Thank you.
Kurt, how many schools did you say we had in New Mexico?
Public schools, a little over 425.
Okay.
And charter schools, we've got over 150.
Great.
Okay, thanks so much. Next, we will turn to Tommy Lopez, followed by Susan Montoya Bryan, and then it looks like Chris Mckee, you've raised your hand again, so that'll be the beginning of our second round of questions. So where'd you go, Tommy? There you are. Tommy, you are unmuted.
Thank you guys, as always, for doing this and giving us all this information. I wanted to actually ask about case counts in New Mexico. And forgive me if this has been asked at all in the past few weeks, but do you guys see any correlation between Balloon Fiesta and all the out-of-town visitors and any possible contribution from all of that to the uptick in cases that we're seeing right now? Thank you.
Yeah, this is David, and I'll start. You know, there are a couple ways to get at this. One is we know at any given point in time, everybody who's in a hospital with COVID from out of state. And typically that runs, 10 to 15 or 20 people. And almost none of them are ever transferred here from like a Texas or Arizona hospital. They're almost all people on vacation. So yeah, we've got some folks who come here. Now, we don't know if they brought the COVID with them. Did they get it here? We don't always have that information. I think travel in general is what creates and spreads pandemics. The pandemic as we know it in New Mexico, at least back in March and April of last year, started with a couple plane flights. And so there's always that possibility. The previous variant that we had that originated in London, that Alpha, that spread across the world by travel, and Delta, of course, the same way. So it's just an assumption that people moving about the country and the world interacting do bring in cases. It isn't, we don't have evidence though that it's a primary driver, or like right now it's more of a driver than it's ever been before, at least with hospitalized cases. Those folks tend to all be, almost all from New Mexico, and the state of origin of cases has stayed pretty constant through the pandemic as well, with New Mexico being well over 90% as well. We've got some epidemiology reports. If I can dig one up, I'll mention it later, that sort of go into that in a little bit more detail.
Okay, thanks so much. Next, we'll turn to Susan Montoya Bryan, and then I think we'll start that second round of questioning with Chris Mckee, followed by Julia Goldberg. Susan, you are unmuted.
Hi, good afternoon. Susan with the Associated Press here in Albuquerque. And you had mentioned the mad rush. So I was wondering if you could tell us, roughly how many thousands of people have already registered for the 5 to 11. And as part of that, talk a little bit about the rollout. Dr. Scrace, I had heard you mention several clinics that the state is planning. So any details on those clinics, where they'll be, and whether pediatricians, eventually all of them, will be able to give these shots? Thank you.
Okay.
Go ahead, Laura.
Sure. So we do have a pretty robust group of providers who are pediatricians, family physicians, different hospital systems throughout New Mexico, like Presbyterian and their clinics. We have federally qualified health centers who are going to be giving them out. IHS, the Indian Health Service, is going to be giving out vaccine, and also pharmacies. So these will all be coming online. Most of the pharmacies will be coming online on November 8th, is what I understand, is when a lot of the other federal doses are coming in. And like I said, it's a staggered dosing. So there will be, we believe there'll be enough capacity. I think initially there might be some waits, just because the mad rush of the 30% of people who like to get it first, that group will be spread out throughout the next 2 weeks, we believe. And so our public health department has really stepped up as well. And they're going to have some mass vaccination sites in Albuquerque, in Las Cruces and Santa Fe, in some of the larger locations. And they'll also be doing some school sites throughout. And so you'll be able to find all of those on our registration app. The vaccinenewmexico.org has a calendar area where you can look at all the different events. You do have to click Pfizer 5 to 11 to, because otherwise you get all the other kinds of vaccine events that are available. But we are trying to do as much as we can to meet that demand. We're not sure what that demand is going to be yet, but we have a lot of sites. And we did the similar thing with booster doses as well. And where we, opened up a bunch of locations. We did the similar thing for the 12 to 15 and the 16 to 17. And we also have a contractor coming online, hopefully by the 15th, who will provide other vaccination sites that are larger. But yeah, it'll be a mix. But we're hoping we'll be tracking that in the next few weeks to make sure we can meet that demand.
Yeah, Matt, I think it's a good idea. Susan asked a great question. I have some dates and locations, but I'm nervous that since I got them by text message, I don't want it to be out there in the media, but I am pretty sure we've got a Saturday clinic coming up a week from this Saturday in Espanola, Santa Fe, and Las Vegas. I'm pretty sure we've got 3 Albuquerque vaccine events in the next 2.5 weeks as well. So maybe what we ought to do is put out a little, media update with those dates and times of the bigger ones.
Yep, great idea. We'll do that. Okay, next we'll turn to Chris Mckee, followed by Julia Goldberg, and then Jessica Pollard. I don't think has had a chance to ask a question, so we'll turn to her before cycling through the rest of the list. Chris, you are unmuted.
Okay, thanks again. Chris Mckee here at KRQE News 13. I just wanted to ask a little bit more about the situation in Farmington. I know, Dr. Scrace, you had mentioned a little bit earlier in the news conference they're overwhelmed. If I remember correctly, it was 36 people, or it sounds like going to go work there to help out. But I'm hoping that perhaps you can paint a detailed picture about what does it mean when they're overwhelmed. I think some of us think to TV shows and entertainment where they see doctors running around hitting machines that are beeping and screaming and stuff. But I am struggling to sort of figure out, without sounding like a broken record in the media, when we just say, oh, the hospitals are overwhelmed, and we want to help paint that picture without just telling people the same thing, right? So any detail that perhaps you might be able to provide, kind of outlining what is the situation in Farmington, any kind of descriptors you can offer us. Thank you.
Yeah, and I really appreciate you bringing that up. I don't, as a scientist, probably overwhelmed is not like a specific scientific word for the situation or in healthcare. It's an emotional word. I think the emotions people in the delivery systems across the whole state are feeling center a lot about being overwhelmed. But when I say that we have our biggest problem in Farmington, what I'm saying basically is that hospital does not have the resources to provide intensive care, general medical care, emergency services for everybody coming in like they usually would, plus that safety valve that we've traditionally had in New Mexico is sort of being, at least during the pandemic, one giant ICU. There aren't other places. Like last December, you might have remembered Jennifer told us this a couple weeks ago. Last December, it was full, but we could still move people and offload rural hospitals. Now we can't do that. So we've ordered up and contracted for 41 additional healthcare personnel to help out. And then that federal DMAT team of another 36 people. Also, we believe heading to Farmington in the next couple of days. So that will give them additional emergency room staff and nurses and other personnel so that the number of resources they have can at least catch up to the demand and to the demand. More concerningly is it's okay, like it's a problem if you're short a nurse on a shift, but if you're short an ICU nurse and you can't staff a patient, that means that patient who needs ICU care may have to get it on the floor. I mean, we have dozens and dozens of patients in New Mexico who need ICU care sitting in emergency room beds right now as well. And so, so we are not able to move people to that ICU level of care in particular, or inpatient level of care. So the simplest definition, Chris, is just the need for services has now outstripped the ability to provide services. And because healthcare workers are who we are, we just keep extending ourselves more and more and more. We think like we're the personal solution to the shortage. And it sounds funny, but I'm sure Laura would agree that, most physicians, most nurses, if they had to work a double shift or a triple shift because someone's life depended on it, would do it. And they've been doing it. And that's why so many folks are feeling so tired and overwhelmed. So I think numerically, though, that we also know one last thing, that there's this thing called case mix index. And it sort of describes how sick on average is a person in the hospital. And even taking out all the COVID patients, the patients in our hospitals across the state, every single hospital is reporting record case mix index, record severity of illness. The average patient in every New Mexico hospital, not including the COVID patients, is sicker than ever in any of their experience. And then you add the COVID patients in who have, as I mentioned, 19% mortality rate if they're admitted to the hospital. And so hopefully that fills in some of the gaps. I think it's a combination of the need for services outstripping the capacity and the tendency in general for healthcare workers to reach out and try to do more and more and more. Hope that makes sense.
Great. I think next up we had Julia Goldberg, followed by Jessica Pollard, and then I see Jeffrey Plant has his hand raised as well. So we'll go in that order. Julia, you are unmuted.
Thanks again, Matt. Thank you again, everyone. I was hoping you could talk a little bit Dr. Patahoun, you'd said the medical advisory team reviews all the data on the 5 to 11-year-olds. I read through the briefing document for the Vaccines and Related Biological Products Advisory Committee and tried to watch the hearings. And I'm wondering if the MAT talked to any degree about the benefit risk scenarios related to myocarditis and pericarditis. And if you could sort of share a little bit of that, what their thought, obviously their thoughts were that the benefits outweigh the risks since you're approving it, but just maybe a little bit about the discussion and what you can sort of tell people who are concerned about that. Thanks.
Yeah, I mean, I can start. And Dr. Laura Banks from the university, who sort of valiantly headed up our MAT team and got a special award from the governor for doing so. still heads up our vaccine team. And there are two things they do. One is they review what evidence is out there just to make sure that the approach that was taken was sound. And so that kind of gets to the point you're making. Yeah, they did review risk benefit. They looked at, it's a decent sized group, maybe a dozen people, and they watch the hearings. They assign someone to watch the hearings and listen to the discussions as well and bring that back. I think the other really important purpose they serve, since we do have a pretty robust and reliable process at the federal level now that I'm actually really happy with about this, is they sort of look at the data from a New Mexico perspective and what's unique about New Mexico that might be different than the study population. Now, in this case, we had kids from New Mexico in the study population, so that really helps. But do our race and ethnicity differences from other states, is that something that should play a factor here? And then the other one is, does having the highest social vulnerability in the country, is that something that would make a difference here or have an effect? And I think in this particular case with the other vaccines, they've agreed that no, that they're effective, and at the same time they are, that there's nothing about our population that would make us want to hold our hand up and say we better think this over more carefully. So that was just a little review, but they listen to all the meetings and everything.
Does that mean, Dr. Space, that risk of myocarditis doesn't have any relationship to like higher comorbidities necessarily in that age group?
One thing we're lucky about is, poverty certainly, I think we're number 1 or 2 in the country in childhood poverty. So putting on my HSD hat for a minute, that vulnerability is there. But, comorbidities are not as big of an issue in kids as they are in adults. Most of the things that we think of, diabetes, high blood pressure, heart disease, pulmonary disease, making it much, much higher risk, of a COVID hospitalization or death, are way, way, way more prevalent in adults than they are in kids. And so I think that gives an extra measure of safety. They looked at the myocarditis, and, the smaller dose is probably going to help reduce that risk as well. But I think, overall, your risk of getting myocarditis from COVID is still higher than getting it from the vaccine.
Thank you.
Great, thank you. Next, we'll turn to Jessica Pollard, followed by Jeffrey Plant, and then back to Susan Montoya Bryan. Jessica, you are unmuted.
Hi there. This is Jessica from the Santa Fe New Mexican. I had to step away from the conference for a moment, so I apologize if this question had already been answered. But I just wanted to learn a little bit more about how Test to Stay is as safe and effective as a 10-day quarantine. If anyone's able to kind of give me a little bit more information about that so that I understand.
I'll start, and Kurt, if you want to jump in as well. I think this is a study we're doing with the CDC that has a lot of promise. The testing at days 1, 3, and 5 really does identify early anybody who might be COVID positive. It isn't really a question of, to me, what the relative safety of the two. We wouldn't do it if we didn't think both were safe. Certainly if you went home and stayed in your room and people slipped meals, through a little small door at the bottom of your door, and also all those sorts of things, spread risk would be decreased. But the other comorbidity of COVID is reduced learning from trying to learn at home. And so I think Secretary Steinhaus here is trying to figure out, how do we maximize learning potential of New Mexico kids and stay within that margin of safety that we absolutely insist on to ensure that kids can learn in a safe environment. And so this study we're doing with the CDC, and there's 3 other states that are in on it too, is really sort of groundbreaking work, I think, that's going to enable us. And remember, it's not the kids with COVID will get COVID. They go home and they stay at home in isolation for 10 days. We're just talking about contacts of kids who've been COVID positive. and contacts of kids in school who've been COVID positive. So our epi team, myself, I think Laura, we all feel like it's a great, safe alternative. Laura's had experience with using this method in other settings in shelters and found it very effective as well. But Kurt, from the education, sort of walking the tightrope and balancing those two priorities, did I cover most of it?
I think, David, you covered it really well. I'll just add that all of us in the education world, even though we might have a doctor in front of our name, did not get a degree in medicine. And so we look to the medical professionals for their advice, and the advice we've gotten based on their careful review of the data is that this is a safe way to go. And we even have 3 people from the CDC in Alamogordo right now collecting data and will be reporting back to us. So I appreciate the question about safety. That's what we're all about. And we will continue to monitor it very, very closely to make sure that this truly is a safe way to keep kids in school.
Thank you.
Thanks all. I think we had Susan Bryan next, followed by Jeffrey Plant. But I think we've gotten it's gotten a little confusing only because I think what's happening is folks are immediately raising their hands after they've asked a question. So I apologize if I'm going a little out of order, but we will get to everybody here. Susan, you are next. Feel free to ask your question.
Thanks again. Yeah, I just wanted to ask Dr. Steinhaus about the T2S program. So can you tell us a little bit about funding for that? Is that CDC and what's the price tag look like for New Mexico?
Let's see, I can start. The grant that we got from the CDC, if I've got this right, was about $63,000. And that includes distribution to every school in New Mexico. So if you were a principal at a school, you have already got notification of an allocation of $70,000. And so every school in New Mexico, no matter how large or small, you at least get enough money to hire a full-time person to help with this. And then we are adding $30 per student on top of that, so that helps with the volume in the school. So that's the way the funding is working.
We're also exploring whether we could do this in childcare centers as well, and beginning those discussions. We do have pre-K in schools, and CDC has said, yep, we're in with you to do this in pre-K in schools, but we'd like to see how that goes before we think about extending it to childcare centers, but we're working with them as well. And remember, the federal government, FEMA in particular, does support testing throughout the state for anybody where the insurance doesn't cover it in almost every single situation. And that could apply here as well.
I don't know if I could share a visual, because I did that might like just help, wrap people's head around how test to stay could potentially work. Is that okay if I do that? It's just a cool visual. We actually published this data in a journal showing how we did a test to stay type program at the shelter. So before we had test to stay, if someone became positive in a shelter setting, the red is positives. We didn't have a test to stay program before because we didn't even have rapid antigen tests. So we had to wait several days till we got someone into isolation area. So you could see how quickly, COVID spreads if you have to wait 3 to 5 days to get your, PCR test back, which is how long the normal test. And so you could see you could get a lot of positives. After we implemented the test to stay program inside the shelters, which basically we rapid antigen test people once there was a positive every other day, just like Secretary Steinhaus was sharing, then you would pull out anybody who's positive every 2 days, right? And then they wouldn't spread it. So you can see that the shelter stayed open. You didn't have a lot of positives anymore because you pulled out all the kids. In this case, it would be adults, but in the case of schools, you would pull out any positives so that they wouldn't spread, spread COVID in the, I don't know, I just thought that's like a cool visual to kind of imagine how that could happen in the school setting.
Yeah, and just one last thing too, it is $63 million from the CDC we're getting, and the grant is specifically for screening and diagnostic testing in our schools. So I think somebody might have said 63,000, but it's 63 million, which is a lot more.
Thanks for that correction. I was off by 1-0 there, David. Thank you.
Actually, it's 3.
Oh, 3.
Yeah.
Thanks all. Next, we'll turn to Jeffrey Plant, followed by Tommy Lopez, and then Jessica Pollard. I think you're raising your hand once again. I think one thing that would be helpful just to all the members of the press corps that are here is if you're, thank you, Jessica. Yeah, if you're able to just lower your own hand after you've asked your question, that's really helpful. I'm trying to do that myself, but sometimes I miss it when I'm clicking the other buttons. So great, thanks, Jessica. Next, we'll turn to Jeffrey Plant, followed by Tommy Lopez. Jeffrey, you are unmuted.
Speaking of missing zeros, I have a remedial question for the benefit of math challenged individuals like myself. I was hoping that Secretary Scrace would remind us how to interpret the new cases per 100,000 number in layman's terms and how to calculate that as a percentage. I think it was. You explained this really clearly in a previous update. If you wouldn't mind doing that again.
Do you want it for a county, Jeff, or do you want it for the state? Because the state's really. Okay, well, let me start with the state.
Okay.
So let's say 4 weeks from now, we have 10 cases per 100,000 in New Mexico. We've got 2.1 million people in New Mexico. So 2.1 million is the same as 21 times 100,000. So we have 2,100,000 of people in our state. So you take that 10 cases per day per 100,000, multiply it by 21, you get 210. We do it backwards. We get the 210 cases first, then we would divide by 21. In your county, you take the cases in your county and you just divide that by the number of 100,000s you've got. So, and I think I might be able to bring up the that report. I think I had it up earlier. Let me just get your county population because I've got it there. So Grant, right, Jeff?
That's correct. 112.5 per 100,000.
All right. So Grant, yeah, you're number 1 right now, right?
That is correct.
It's 112. You had 439 cases in a 14-day period. So first you divide by 14. Sorry about this, but it's gonna get, let's just keep the number sort around. It's gonna come out to about 30 cases a day. And then you got 27,862 people. So let's just pretend that's 25,000. So you have 1/4 of 100,000, okay? And you've got 30 cases. So 30 divided by 1/4. So in your calculator, 30 divide 0.25 equals, that would be about 120,000, which is kind of close to the number you're at. So if you took, and since you're on and you're asking a math question, and I'm worried Julia is going to get jealous because she has competition for math questions right now, but 27,862 times divided by 100,000 is 0.278. So so that you would just divide by that or multiply by, well, hold on, I can do that for you too. So you multiply by 3.59 to convert your cases per day into cases per 100,000.
Thank you. I'll be studying that this evening.
Okay. I think, Laura and I can work on getting you some CME credits for our little tutorial there. It is complicated. I think once you figure out how many 100,000s you've got in your county, it makes it a lot easier. And you just use that number, write down 3.59, divide that number of cases in our report by 439 and by 14, divide the cases by 14, and that's all you need. Sorry about that complexity of that.
David, while we're doing math here for a second, I just wanted to make sure we had the right numbers. When I gave you the number of schools, I was talking about elementary schools. So the total number of K through 12 schools across New Mexico is a little bit over 800. And then when you add in private schools and tribal schools, we have over 1,000 schools in New Mexico.
Okay. Thanks.
All right, thanks so much. Looks like we only have one hand remaining. That's Tommy Lopez. So for other members of our press corps, if you'd like to ask a final question, now's a good moment to raise that hand. Otherwise, we'll probably wrap up with final statements after Tommy's gotten a chance to ask his question. So Tommy, you are unmuted, and then looks like we've got one more question following that. Thanks so much.
Hi again, guys. I wanted to circle back to booster shots for adults. We've heard some reports that it can be difficult for some people to get an appointment for a COVID booster shot nearby. Either the calendar is not showing any openings when they're in the process of registering, or the location of where they might be getting this appointment isn't super clear. Do you have any insight on this? Have you also been hearing this? And could this be an availability problem or some other kind of logistical issue? Thank you.
Yeah, I can take that first. Yeah, we have heard that where people aren't able to get it like exactly in their neighborhood, and they have to go a little bit farther out. It's not, I don't think it's an availability issue so much as, you know, the majority of people who are giving the vaccine, the vast majority are the pharmacies. And so they have a limited capacity per day. So eventually people can get it nearby their homes. We also have a lot of public health department vaccine sites that actually have a lot of slots available and open, but they may not be like super close to your house, like a Walgreens or CVS or some pharmacy. And you're right, that is something we have been trying to talk to the pharmacies about to see if they could open up more slots. But now with children's vaccines, I think we are in a situation where there is a limited supply of more like spaces. So it's not like you can't get your booster shot eventually, but it may not be as quick as, you know, as in your own neighborhood. So that is something we have been looking at and trying to address that. Yeah. There is definitely, we wish there were more slots available for the boosters. We do have mobile vaccine sites. So if it's a group like a church or an organization that wants to have a special vaccine event, we still have that available through our vaccine mobile teams. But I totally get that the pharmacy sites, we still need to try to see, or other provider sites, you know, that are available. There's so many competing demands. Anyways, David.
I was going to say too, I think where we want to go is for people to get their booster shots where they get them now, where they get all their other shots now. So either in their pharmacy or their primary care clinic or their public health, wherever you're getting your shots now, that's where we'd like to see, you know, other shots. That's where we'd like to see these vaccinations occur as well. So, and that's why I think I'm excited about the 5 to 11 group, because I know the pediatricians and family physicians are really excited about this. And there's a big preference actually amongst parents in other municipalities where surveys have been done to get them there if they can. So we're doing everything we can to make those places ready to give the shots.
Okay, it looks like Michaela has lowered her hand, but Chris Mckee has raised his. So we'll turn to Chris Mckee next. Chris, you're unmuted.
Well, I had one follow-up question about the testing for schools to stay in schools program. One of our coworkers here is dealing with just a kid who had just been exposed and is going to have to stay home for 10 days. The question kind of came up, is it really going to be 2 to 5 weeks before something like this is really in play, or is it really just going to be, I think we were talking maybe a little bit about this earlier, so forgive me if this is kind of a repeat question to some extent, but what is really the variable and how long this takes to get going in a lot of these schools? Is it just going to be sort of proximity to the metro area, a rural nature, or are there any other variabilities that will maybe get this going faster?
See, Chris, we all wanted to get up and running as quickly as possible. Probably the biggest variable is to find a person out there to help do that testing in the school. You may have reported previously that we are short over 1,000 teachers, and that's by far our number one priority. But this is finding a person that can, first of all, be available in the school to give the test, secondly, to take the training, third, to be certified. And then another variable out there is ordering the tests themselves. And so we think that is probably going to happen pretty quickly. And the third variable is just making sure that we get parent permissions, because children do have the choice. Their parents can say, no, I would not like my child to be tested with a rapid test at school. So those are three of the main variables we've got out there.
But I think it's great to hear that that everybody's going to be excited to get this done and want to have it happen and encourage it to happen. And I think the governor in particular is really wanting us to do everything we can to keep kids in school and set up testing and all these other sorts of things as quickly as we can. It's a big job to do the whole state. But as you heard already, I think 63% of districts already signed up. So that's the first step. I believe checks have gone out, and the funding for this has already gone out to those schools that have signed up, right, Kurt? And so I think we're going to be, I think you'll see movement soon, and hopefully school districts around the state popping up one at a time as they gear up to do this.
Yeah, David, that was well said. And I'll just also add, Chris, that I met with school leaders, superintendents yesterday morning, and their reaction was very positive. They're on board. So having their leadership to move quickly is already in place. So I'm happy about that.
I think most of them will, but I think we're going to be using every testing resource we have in the state to do it. And, in theory, our actual test turnaround time, we haven't shown that table in a couple of weeks, but it's running 1.3, 1.4 days statewide for all comers. And if you take out the mailing out of state, the UPS ones out of state, it's getting closer and closer to just a day. So we can use those other tests to test kids in the morning at school and then notify them the next morning about their results if they're positive. So it'll be all of the ones that we can, all the testing resources we have available we'll bring to bear to help make this happen.
Thanks, everybody. I'm not seeing any more hands raised, so I'm just going to give it 3 seconds. Okay, looks like everyone's had a chance to ask their questions for the day. So in that case, I'll turn to our principals for any final statements they'd like to offer.
Why don't we start with Kurt and then Laura, and then I'll just finish up.
Sure. I'll just add that we've said thank you to first responders and frontline workers in the medical field, and I think that's always appropriate. I'd also like to ask our media partners to extend a big thanks and appreciation to our frontline workers in schools, because most of them have degrees in education, and they're there to teach English and all the other fun subjects. Mathematics is one of them, David, that gets taught at our schools. And so we've got nurses, we've got custodians, we have all kinds of people in a school who are contributing to helping make this a safe place and following all those COVID safe practices. Every school in New Mexico has developed and submitted an enhanced COVID safe plan, what they're doing this year. So please help us thank all those frontline workers in our schools. Thank you.
Thanks, Kurt, for sharing that and reminding us of the importance of all those school teachers out there and all the staff keeping our kids safe in the state. That's so inspiring. And yeah, I want to say thanks to them too. I'm just also really excited about the 5 to 11-year-old vaccines. That's going to be another layer that protects our kids in the schools. And so, yeah, just hoping we can start, getting more and more kids vaccinated, and that will help a whole lot for school age kids. So thank you.
And I'll just end with two things. One is Jeff and others who are interested in how to do the math. I did put step-by-step instructions on how to calculate your case rate per 100,000 using a 14-day case total that you'll see in the county level EPI report that comes out every Tuesday. But I think more importantly than how to do it is that they're all really high. The whole state basically is still pretty red. I think the CDC cutoff for red is 14 cases per 100,000, but we are seeing spread everywhere. And so the virus is expert in a non-sort of volitional way at spreading from person to person, to finding unvaccinated families and large groups of people at who are unvaccinated at events. We talked about this. One of the very first things we saw with Delta was this cluster phenomenon that continues. And so this high case count is not just one person here and one person there getting COVID, but it's clusters of people in every county who are spending time together getting the virus. Out of respect for our beleaguered healthcare system, where in many instances we have less resources than we do have the people who need those resources, please be safe. Please wear your mask, particularly indoors. Please talk to your trusted healthcare person, doctor, nurse, family member, whoever that is, about getting the vaccine. And if you haven't gotten the booster yet, this would be a really good week to sign up to get the booster vaccine. As we see people applying, we're in places where there are no available appointments or nearby sites. We work on that to meet those needs. So please go in today, register for your booster and get that soon. That will help us also fight this pandemic effectively. And with that, Matt, I think I've stalled long enough for Jeff and others to calculate, to cut and paste out the math instructions in the chat for the reporters. I think I'm going to send it back to you to say goodbye.
Sounds great, everybody. Thanks, Dr. Scrace. And yes, we will most likely be back next week, but certainly on a continuing and regular basis with these press conferences. So thanks so much for your attendance, and we'll be in touch very soon. Good afternoon.
Thanks. Take care, everyone. Bye-bye.